If you have a newborn baby or an infant who is extremely fussy, especially after meals, or suddenly breaking out in hives or eczema, or just having either constipation or diarrhea or mucousy bloody stools, and you're trying to figure out what is going on with my baby, it may be cow's milk protein allergy. Hello, I'm Dr. Lum Frundi. I'm a pediatrician and founder of Generational Wellbeing. Thank you for joining me here today. Today, we're going to talk about cow's milk protein allergies. We're going to talk about what it is and what are the symptoms and what you can do about it, because it is more common than we think about it, affecting about 2 to 3% of infants worldwide. So on a daily basis, we see kids who are just having with parents who have concerns either with just hives or eczema or constipation, but we have to look at the whole picture once we bring things together. Sometimes cow's milk protein allergy may be that thing that's causing your baby such discomfort. Now, what is cow's milk protein allergy? It's when your baby's immune system sees the proteins, the milk proteins in cow's milk, specifically casein and whey protein, and they look at it as foreign and they build an immune response targeting those proteins and then leading to those symptoms that I talked about, like hives, so eczema. Some kids are extremely fussy. Some will have excessive reflux, and if you have questions about reflux, I have another video about reflux versus spit up in infants. Or they may have mucousy bloody stools or diarrhea or constipation. With most of the symptoms, it may range from mild to severe, and it typically will occur after a formula feed with cow's milk protein formula, or in a breastfeeding mom who is consuming a lot of dairy products or suddenly eats a lot of dairy. So that's what the immune system sees it as foreign, builds immune response, and then leads to all of these symptoms. Now, if you have a baby then who you see that suddenly has eczema hives immediately after feeds or sometime after feeds, or sometimes it can even have respiratory symptoms like cough or runny nose or wheezy, your baby just sounds congested and kind of wheezy and coughing all the time, you may want to talk to your child's doctor to do a full evaluation to see, is this cow's milk protein allergy? Now, if we have looked, your baby has those symptoms, your baby's super fussy, and we see that it's probably a cow's milk protein allergy, then what can we do about it, right? So like we said, since your baby's immune system is responding to those proteins, then the primary thing to do then is to eliminate those proteins, right? I had a patient whose mom was exclusively breastfed baby. Baby was fussy, colicky. We're doing all the evaluations. And there was one time mom came in, and when we went through her diet or what she had been eating, that night prior to when she came to see me, she had like a Mother's Day out. She went out with her friends and they went to a Mexican restaurant. She had a lot of tacos and cheese and all of that stuff. And the next 2 days, the baby was super fussy, broke out in hives. She's extremely refluxy. Really, that's what brought her in, and evaluating and going through all of that, come to find out it was that cow's milk protein allergy. And she ended up having to go on an elimination diet where she had to eliminate dairy from her. I think with this particular parent, we ended up eliminating even with the nightshades, because there's some very few kids who will be super sensitive to those as well. Yeah, and after eliminating all of that, the baby was fine. Now, elimination is one of the things. It may be difficult for some parents, and some parents are okay. Now, if you're one who like elimination, it may not be it for me, or it's extremely difficult, they have cow's milk or hypoallergenic formulas that will create the same kind of outcomes, whether it's hypoallergenic like the Alimentum or Nutrimogen products or other products that are hypoallergenic, or some kids may need even the further broken down products like an amino acid based formula like a Neocade or something else that is broken all the way down. So doing either one that is best for you and your family, and whichever fits you, because you want it to be not too stressful for you or your family while you're doing any of this. Now, when we're talking about elimination diet for a breastfed baby, you want to also make sure you're reading labels when you're looking at what to eliminate, because there are milk proteins in a lot of things out there. So it may be a bit stressful, it may be challenging, but once you have that said, once you look at the labels and make sure you're eliminating those things that have the cow's milk protein allergies in, that may help your baby's skin rash, that maybe help with that cough and congestion and the fussiness and the reflux. Now, whether it's elimination or removing or changing the formula, then you want to keep in mind that it may take up to 2 to 4 weeks to see that fully resolution or an improvement in the symptoms of your baby. So sometimes taking it out 1 day or 2 days at a time, you may not see immediate change, but just know it is working, because it takes about that time frame to get all of that out of your baby's system. So be patient, and you also want to make sure you're talking to your child's pediatrician before starting these, because whether if we're going the route of the formula, those formulas are expensive, right? So sometimes your child's pediatrician may be able to guide you on how to do it, where you're doing it efficiently and effectively and in a budget-friendly way. So those are the two big things we'll say about just helping your baby with those two things. Now, if your baby has eczema or very irritated skin that comes with all of this, then you want to make sure, just as we're eliminating those things from the diet, you want to be mindful about what kind of products then that you're putting on your baby's skin. You want to stick with the hypoallergenic creams, and you want to stick with the soaps for sensitive skin, because you also want to make sure that you're taking care of the skin, because these rashes tend to be very itchy or sometimes create discomfort that will cause them to be fussy too. So it's that vicious cycle. So while you're taking care of the gut, you want to make sure that you're taking care of everything else you're putting in the baby's body, so that they're all soothing products as well. I hope you found this video helpful. Please leave a thumbs up. As always, tag a friend or share with a friend or a mother or whose baby is having symptoms similar like this, so that they can now start making changes to have a baby who is healthy and thriving. Imagine having your baby, feeding your baby, and not having to go through the struggles during mealtime where your baby's eating and crying, or their skin is like red hot fire. So we want to help you make sure we're making those changes for you and for your family, so you can raise a healthy, thriving babies. Thank you for listening. Until next time, I am Dr. Lum.